I got a call from my cardiologist, Dr. Reddy, who said we need to check things out. Found that one of my main arteries was 70% blocked. So we put in a stent, and that was in February. And after that, he recommended that I do cardiac rehab. And Rush is my hospital, so I did it here.
I went to see the doctor. She scheduled a few tests and found out that I had a blockage that needed a stent. Went back to the doctor, and she suggested this rehab. Rehab? She said, yes, exercise. And I said, that's okay. I'll try it.
The cardiac rehab program at Rush Hoak Park is an outpatient program. It is typically 36 sessions done 2 to 3 times per week. The patient really decides if they can come 2 times per week or 3 times per week. So it takes approximately 4 months for them to complete the program.
It establishes a discipline, which I think cardiac patients need for complete and continuing health. Since I did rehab, my blood pressure has gone down, and of course I'm on medication, but I was before as well.
The information that they gave us, some of the food that I was eating has too much salt in it, and that was surprising to me. Not a lot of red meat, just a whole list of things that we shouldn't eat.
That there's often a fear that develops, especially after a person has a heart attack. Do I push myself too much? That's the advantage of cardiac rehab, because with an exercise physiologist and nurses around you, they don't bug you all the time, but they monitor you. A very safe and controlled place.
They have an EKG monitor on them, which is cordless. So we're monitoring every single heartbeat that is happening when they're cardiac rehab.
It's nothing to be afraid of. You're not going to have a heart attack. It's going to help your heart. It would help you to breathe better, help you to walk better, help you to do an exercise.
Each week, we increase the intensity or the incline, and then we're continuously adjusting or re-investigating how are their risk factors doing, their cholesterol, their blood pressure, their weight, as well as their psychological health.
I could do a lot of things that I wasn't able to do before I had this rehab and the stent put in my heart. We'll go shopping. Of course, I had to sit down for a while, catch my breath. Now, I can walk one end of the mall to the other end of the mall and not get out of breath. I used to regret going downstairs to do my laundry, but now it's very easy. I think nothing of it.
This is not about becoming a marathon runner. This is about getting back to being a productive component of society, productive component of your family, and back to being who you want to be. So we help that.
7 days a week. Either I walk early in the morning, about 5 a.m., or I ride my bike about 7 miles. And my endocrinologist, Dr. Cunningham, and my cardiologist, Dr. Reddy, both seem to think that's a good routine for me. I just like to go down the road and I get to where I go and sit for a couple minutes to rest and then bike back home.